I feel that nurses are the heart of the emergency department.
We're the heart of the emergency room. We care for the patient, and not only the patient, we care for their families as well.
I often feel this pumping rhythm, and I see just so much happening via the nurses.
What we do is beautiful.
My goal is to touch somebody's life.
It's so painstakingly stressful, but you love it because it changes people's lives. You just make a difference.
No, it's not just a job. It's a calling. You have to want to do it every day, day after day.
I think there's a sisterhood, brotherhood between all emergency room nurses.
We go through things that most people will never see in their lives or be able to handle in their lives. What keeps me at Mount Sinai are my colleagues.
They are some of the smartest, most confident people that I've had the pleasure to be around.
Our department is bold and beautiful and badass.
All the people that I work with are beautiful, beautiful spirits.
You're dedicated to the unknown. You don't know what's coming through that door.
We always find a way. It doesn't matter. It doesn't matter how busy we are or how much faster we need to work. It's not always easy, but it's always possible.
They make me want to be better every day.
I'm Michal Shamli, and I work as a nurse in the emergency department at Mount Sinai Morningside, and this is my 10th year doing that.
My name is Anselm Reed, and I'm a clinical nurse, and I work at Mount Sinai Hospital Emergency Department.
My name is Brianna Green. I work at Mount Sinai South Nassau in the emergency department as a nurse. I've been there for 6 years.
My name is Brendan Carr. I'm the chair of emergency medicine at Mount Sinai, and I'm incredibly grateful for the opportunity to say thank you to the nurses across the emergency medicine system at Sinai for everything that you've done over the course of the last 2 years and over the course of your careers.
My name is Geraldine Millington, and I'm a nurse in the emergency department at Mount Sinai Queens.
My name is Casey Cummings. I've been a nurse for 2 years and have been working at Mount Sinai Emergency Room.
My name is Valerie Merrill. I'm an emergency room nurse at Mount Sinai, Brooklyn for about 10 years.
Because of you, we are standing tall and we're standing strong today.
The pandemic taught me a lot. It taught me that tomorrow's not guaranteed.
The nurses have seen some things that not everybody can understand, and it's definitely still there.
After going through that, I didn't realize how much I loved nursing.
I was able to hold somebody's hand while they went through something horrible. I was able to sit there and give someone a little comfort when they weren't allowed to have visitors. So I think that's something that I'll be proud of for the entirety of my career.
We did our best. We did our best. That's what I can really say.
I could never lose hope, because if I lost hope, then what would be the point? My team definitely gave me hope.
I would say even my closest family members don't know me the way my colleagues know me, based on the things we've experienced together.
We grew closer as a family in the emergency room, how we give each other strength, motivation, confidence to move on and to make us a better world.
I think every boundary that could have possibly been pushed was pushed during COVID.
I think from having to be so innovative throughout the last 2 years, we kind of gave ourselves that power.
We really pushed the boundaries in terms of what we're capable of and how much good care we're capable of giving to a lot of different people at the same time, and learning on the way and changing it up really fast. It felt hard while we were going through it, but it felt worthwhile and it felt possible.
Now, we think a little bit more outside the box with certain treatments and certain care modalities and things like that, and it kind of gives us a little bit more freedom to try new things or see in a different light of how things are treated or how patients are cared for.
It brought light at the end of the tunnel where I was meant to be a nurse. It inspired me to be a better nurse.
I think we came out a little bit stronger.
Thank you for your resiliency. Thank you for your courage, for your loyalty, for your sacrifice. You are a beacon of hope and light for each and every single one of those patients that comes in through our doors.
Nurses don't like to be called heroes because they're not doing it for praise.
Would I describe us as heroes? I don't know if that's necessarily the term I would use.
It all comes down to love for each other, for our jobs, truly for our patients.
Because of you, we're going to be able to move forward and improve healthcare in our communities, in our emergency departments, and in the Mount Sinai Health System.
At Mount Sinai, we are we're one team.
I do think the pandemic really brought Mount Sinai nurses and Mount Sinai in general as one big family.
I'm in awe of the people that come to work every day. It is this unrelenting drive towards excellence that defines us, and it's a privilege to be a part of it.
To know that I am a registered nurse in Mount Sinai's emergency room, I feel so much honor and so much dignity in that statement alone.
If I were given the opportunity to say what's in my heart to my colleagues, I would say that I thank them from the bottom of my heart.
I might cry, but I would just want to tell them thank you. And if not for them, I definitely could not have survived the year. They're my family.
I love you. I love you guys so much. I wouldn't be able to do my job without you.
Thank you.